Hello, this is Don Self. Today we're going to talk about our coding advisor that I've had, well, it's been about 5 years creating this right here. And we've had it up and running since around 2010, I think it was, when we finally came out with it. Medical Code Solutions. They're the ones who I use for my coding program. They're the ones I've been working with closely for the last 7 to 8 years overall. And by using our coding advisor, you'll be able to get the last 30 years of coding, training, and practice management expertise that I've been accumulating for the last, well, since 1987. Coding Advisor Platinum Editions. Basically, the price is now reduced from $299 to $150 per year. We've got too many people out there that are afraid to try to use a coding program, or they can't afford a coding program, or their doctors are just too cheap to get a coding program. So we've had to reduce the price to try to help everyone out. With this, you get the CPT and HCPCS lookups. You can look it up by any kind of a method, either the name or the number. The same thing with NCDs, national coverage determinations, and the local coverage determinations. And this is updated every day. Every single day, the program looks into all of the MACs as well as CMS's website to see what the current and archived LCDs are. All of the drug codes and the NDC codes are also found in here in lookup format. Modifier and place of service codes, so you can look them up by either the name or the description or the number on any of these. ICD-9 to ICD-10 bidirectional conversion tool, as well as just the ICD-9. You may be wondering, why do I need ICD-9? Some workers' comp carriers are still using it. So you want to make sure that you still have that available. ICD-9 index, ICD-10, as well as an index lookup with expert coding advice on literally thousands of codes. You also have the CCI edits in an easy-to-search format. Too often people forget about the CCI edits out there, and they really make a difference when you're doing your coding. Online claim scrubber with a denial buster. That's an automatic appeal rider when you get denied claims. But the claim scrubber will tell you so much information. We're going to go into that a little bit for you. And thousands of coding recommendations by me. I've gone through and added literally thousands. I don't know how many overall. If you're billing this right here, make sure you document that. If you're billing this, make sure you also bill this at the same time, or you can use this modifier, etc. And you get my coding advice. It's kind of like having me sitting in your office. You can look up the codes by common terms. For instance, I type in the word wax right here, and it pops up and it gives me removal of impacted cerumen using irrigation, lavage, unilateral, or requiring instrumentation. You'll notice that the word wax is not listed in any of these, or even application of modality when we're talking paraffin bath. But the term wax is in the notes area that we created for each of these three codes to help you look it up. So you can look it up by the terms that's in the description, or by common terms that we've added into so many of the different descriptions and the notes areas. You can look it up by related services. For instance, if you typed in GO180, and you'll find that it not only pops up to GO180, but it also shows the other codes, the GO179 for the repeat signing of the initial of the home health that you sign every 60 days. The GO181, that if a patient's going to be getting GO181, you need to make sure that you've billed out for GO180 prior to this right here to show that the patient's been approved for it. We'll give you additional information on the billing, on the payment side, you'll as well as others. If you point at a specific code like GO180, it pops up and gives you another box so you can see the notes either we or you have created. An option to add this code immediately to the scrubber. The LCD lookup for every locality in the United States. And again, that's updated regularly every day. Pricing, including RVUs, global days, and supervision for whatever dates you have listed in here, by the way, because this you may want to find out what was the pricing 2 years ago or 4 years ago. And this right here will tell you that because it goes all the way back to 2012. Input data from CMS, and it shows you how the code was calculated on the reimbursement. Does it include this supply or that supply? diagnosis crosswalk if one exists, as well as the searchable CCI edits for every code, the ability to copy the code and paste it into something else you're working on, as well as the option for you to edit any notes that you created. You won't be able to edit my notes that's in there, but you'll be able to edit your own that you've created. When we're looking at the pricing information right here, it includes not only the code and what date we're looking up the code for, but as well as facility and the non-facility pricing. As you know, if a physician is doing a service in the hospital, sometimes due to the technical charge, the amount that they're reimbursed is less on Medicare allowed amount. It also shows the amount before and after the sequester amount. Like in this case right here, it would have normally been $40.98, but we went ahead and showed you what you should expect from Medicare because of the 2% sequester amount. And it shows the RVU amounts on the work, practice expense, and the malpractice, as well as the total, and the global fee information. And if it has diagnostic test supervision requirements, it'll show that as well. When we're looking at these, many times I'll have different coding tips in here, literally for thousands of code. As it says right here, CPT code 17,000 should be reported with 1 unit of service for destruction of the first lesion. 17,003 should be reported with the units equal to the number of additional lesions from the 2nd to the 14th, and etc. And it gives you my advice on that. Just one coding tip on one code alone may end up increasing your income enough to end up paying for the entire full year subscription. You get useful information on Medicare versus non-Medicare rules. For instance, if I go pull up code 69209, it's going to show that this code is per ear for commercial carriers and Medicare. And that's different than 69210, which Medicare considers once per patient, not per ear, even though commercial says per ear. And again, note that this is also a nurse service, but it can be a physician doing it if all we're doing is water and not a tool, and no otoscope, no magnification. So you're getting my billing information as well as the coding information as well with this. The date is going to determine the relevant data. So it's going to show you the LCDs or the CCI edits or the pricing, going back to whatever date you put in. Like if I put in here one that was a year ago, if I put one in there for 3 years ago, it's going to show me that as well because it goes back to that date and pulls the relevant data. Also, as I said, every LCD is updated daily with every MAC and CMS in the country, and it goes in and pulls it up for that particular date. What about converting? We're using the same GEMs that CMS uses. So we know that we're going to be accurate if you're ever having to convert over from ICD-9 to ICD-10. How does this compare to buying all the books? I know there will still be some people who insist on killing trees and having the paper books in their office, and that's fine if they want to, but really they don't have to. You might end up spending $109 for a CPT code book. But yet again, if you buy them, that's up to you. You might spend $89 for a HCPCS code book, $99 for a CCI edits code book. I went in there and started looking these up today, by the way, on the pricing. And again, you don't have to buy the books if you don't want to. You looked up the pricing today from one place, $74 for an ICD-10 code book. You're spending typically over $400 a year on manuals and code books. And my program is only $150 a year. And keep in mind that books don't even contain half of what our coding advisor gives you. So you also need to be scrubbing your claims. Instead of waiting until after the claim is already paid, because most folks don't have access to a claim scrubber, they wait for the clearinghouse to submit its end report, and clearinghouses don't assist a lot of times with the RVU issues. In other words, what do I mean by that? If we have 3 different codes on here, the sorting of the claim, of the procedures in the RVU, really makes a big difference, because that can make a difference in how much you're paid if you have the right one listed as first. Because a lot of times the carriers will pay the first procedure at 100%, the second at 75%, the third at 50%. And remember, your coding books don't do the sorting for you, but our program does. When you're coding and scrubbing the claims right here, as I said, the RVU area can make a difference, as well as the modifiers. It can come back in and show you the different modifiers, and they'll show you how much the sorting makes a difference. For instance, a higher reimbursement is likely if 45382 are primary because it has the highest reimbursement amount. So it goes through and does that for you and tells you why. It also gives you a claim validation report. You just hit print and it automatically prints it out so that you can send it off to the carrier, because coding is getting increasingly complicated. ICD-10's not making it any simpler, and this will allow you to contest valid claims that were improperly denied by the carrier. So we added the denial buster to this. It's no extra charge. I know other programs out there are charging different amounts with their scrubbers or not. Ours has everything on it automatically. Compare our $150 a year price to SuperCoder, or to Find a Code, or to Select Coders, or to Encoder Pro. You have to understand, I don't make my money off of the coding programs. The AMA gets to make their money, my programmer gets to make their money. I think I probably make less than $100 a month on the coding programs that I've been putting on this. I mainly use it so that I have it, as well as my clients, my retainer clients have it. You can get a full week's use of trial, no commitment. All you do is agree to spend 10 minutes with us in a live demo so that you can see all the benefits of the program. Then you'll have a full week, and you'll be able to use it. If you like it at the end of that week, then you can go in and put in a credit card and subscribe. It's that simple. So try it before you subscribe. Remember, you can code with confidence. This is much more than just a code lookup tool. It's a complete coding toolbox where you get not only the coding advice from the government and from the coding books, but you get it from me as well. Remember, this has everything in it that we offer, all of it, for the flat rate of $150 a year. If you want to, give us an email today. Drop us an email to donself@donself.com. Give me at least 3 dates and times it's going to be best for you for a free 10-minute demo. I'll set up a Zoom account. We'll log in. You can see exactly how to use this right here. And by the way, you might have multiple coders in your office. You might only need to have one subscription, though. It's like several of my offices, they have several coders, but they just share the same login information. As long as only one of them's logged in at a time, it works. So there's no reason to go spending a lot of money on these things. Anyway, I hope this helps. Send me an email, drop me a phone call. We're here to help you. Thank you for your time.